So I have 3 buckets when it comes to medically assisted weight loss. Folks come in for a consult and this is what I'm going to share about.
It's Doctora Victoria and George.
Bucket number 1. Well, this is the most important. This is the lifestyle bucket. It is how am I eating, how am I moving, and how am I sleeping. When it comes to how am I moving, just for heart health, I want to be getting at least 150 minutes of exercise a week. That is half hour 5 days a week or 1 hour 3 days a week. And if I'm not doing anything right now, well, maybe a baby step is, well, can I do 15 or 20 minutes 3 times a week just to get started and in the habit of doing, well, at least something. Now, that's just for heart health, that 150 minutes. If I'm trying to lose weight with exercise, it's double. It's closer to 300 minutes, which is about an hour 5 days a week. Now, when it comes to how we're eating, often I'll ask patients if they want a nutrition expert on board, mostly because, well, I just don't have that much time to spend with them, and I want to get them all the help that they need. But overall, we want to make sure that we're getting enough protein in our meals so that we feel full and satisfied, and we want to make sure that old idea of breakfast like a king, lunch like a lord, dinner like a pauper, well, I want most of my food at the beginning of the day so I can use it as energy, and less at the end of the day when I'm about to go to sleep. Now, I want to make sure there's at least 3 hours between the last time I eat and when I go to bed, so that I'm not just packing on some extra calories that I can just put into storage because I'm not going to use them. And when it comes to beverages, it's all a scam and it's all marketing. All of those sweet tasting beverages, I don't care if it's stevia, agave, aspartame, sweet and low, crystal light, the little drops folks put in their water, I don't care. Your brain will perceive that there is something sweet on your tongue. It does not care if it is Coke Zero or regular Coke. It will automatically tell your fat cells, hey, I need you to store some energy. And if we're drinking on our 0-calorie beverages all day, you are constantly sending that signal to your fat cells to say, hey, I need you to store energy. And if you're looking at this video, that is kind of the opposite of what we want to do. So, yes, work on that. That's one of the hardest things for folks. And we want to be drinking water most of the time. That being said, we should be allowed treats once in a while, but think of it like a cookie. You have a cookie once in a while. You're not eating cookies all day. So enjoy your sweet beverage. If you want creamer in your coffee, that counts as your sweet beverage for the day. If you want to enjoy your Coke with lunch, well, by golly, enjoy it. But you better be drinking that coffee black in the morning. My other item in my bucket number 1 of lifestyle is that of sleep. And what I really want to evaluate folks for is obstructive sleep apnea. And most people don't know when this is going on, whether you snore or not. I mean, if it's really bad, people do snore, but that doesn't mean you do or do not have sleep apnea. And why I want to evaluate that is because if someone does suffocate all night, which is what sleep apnea is, they are having a harder time to lose weight, along with a whole slew of other things. Heart rhythm issues, mood issues, plain old tired in the day. It's hard to heal or recover from injury. For fellows, it makes testosterone go low, all of these issues. Blood pressure goes high. So for me, it's an important thing to evaluate when I'm looking at a patient with obesity. Now, bucket number 2. This is, well, I'm a doctor. I've got medicine for everything. Bucket number 2 is my medicine bucket. So I've got some oral medications. They've been around a long time. They're affordable if you have to pay out of pocket for them. And the most I can get out of them is maybe about 10% of weight loss. So for a patient who's 200 pounds, that's about a 20-pound weight loss. Now, the fancier, newer medications are expensive, if you haven't heard. And those are our Wegovy and Zepbound for the weight loss version, the diabetes version. Going to be our Victoza, our Ozempic, Mounjaro, all of those. Now, for the shot medications, I expect closer to 20 to 30% of weight loss. So that's going to be, for that 200-pound patient, closer to 40 to 60 pounds of weight loss. Keep in mind, no medication actually causes weight loss. They are only tools that help us do bucket number 1 more effectively. So the medications maybe rev up the metabolism a little bit, but I still need to work out to get that effect, so it'll work a little bit more efficiently for me. Yes, they can bring down appetite, but I still have to choose what food I'm actually eating. And your body likes its weight. It does not want to change. It seems to have no problem getting higher, but it sure doesn't want to come lower. So that means if I exercise, I bring weight down, but if I stop the exercise, the weight comes back. If I change eating habits, I can bring weight down, but if I stop, I expect that the weight will come back, and even more when it comes to a diet. It is the same thing with medication. If I use medication as my intervention to bring weight down, if I stop, I expect that the weight will come back. So that means medication for weight loss is not short-term, it is always long-term, with two caveats. If we're under 30 or the year following pregnancy, medication may not be needed long-term. The reason for that is because we have enough hormonal changes going on in those time periods, under 30 and after pregnancy, that we can reset that body's weight set point and may not need medication in the long term. Bucket number 3, that is surgery. Some folks are like, no, I'm not interested. Let's get rid of bucket number 3. There's a few different kinds of surgeries that we'll do, and I'm just regular family doctor and obesity specialist. I'm not the surgeon, so I'm going to refer out to that if people are interested in considering a bariatric surgery. They're usually a bit of a rigmarole and some training that needs to get done, usually a psychiatric evaluation, because it's a lot of life changes. And if you're not willing to implement those in the long term, then it's not worth it to do a surgery because the weight will come back. And I feel like I've had a lot of questions lately. Oh, well, what about the lap band? I feel like we don't really do the lap band anymore. There's a few exceptions where it is effective for folks, but for the most part, it's not really great. The lap band, if you're wondering, is a tube that kind of goes around the stomach and it's filled with fluid, and there's a little port kind of in your skin, and you can change how much fluid is in that band around the stomach. And folks would go out on vacation. Oh, doc, man, I can't eat. It's too tight. You got to take some fluid out. So if you take the fluid out, you can fit more food in your stomach. They go on vacation and they come back heavier. So it was not real effective. But your gastric bypass, your gastric sleeve, the loop duodenal switch, those kinds of surgeries are, well, they're much more effective. So those are my 3 buckets. Again, nothing works without bucket number 1. And we've got lots of different options when it comes to the medication. So thank you for joining us today, our healthcare team. I hope that you learned a little something new and will join us next time. Bye-bye.